the doctors, that is the psychiatrists, who need to be MBBS and MD psychiatry to be helping you. There is a particular line of disease wherein you need help from psychiatrists. That is schizophrenia, bipolar disorder, that is mood disorder, clinical depression. Another is suicidal tendencies, and the final is personality disorders like split personality and those things. So this is severe mental disorders. These are known as severe mental disorders, SMD. And there are certain disorders which are by the name of CMD, common mental disorders, which a counselor or a psychologist or a psychotherapist can deal with without the help of a psychiatrist. We do not need to give you pills or any kind of medication when I talk about common mental disorders. That is anxiety, phobias, eating disorder, stress and depression. So why? Yeah.
Schizophrenia hiding the own identity.
Schizophrenia. Yeah.
Schizophrenia hiding the own identity. So in this case, what do you do?
There's a whole line of treatment. I'm sorry, I cannot take it up. We can talk on later on this. We will, because schizophrenia is a very, very researched disease. So there are various types of schizophrenia again, and there are various different lines of treatment in schizophrenia. So in a schizophrenia suffering person, you have to keep in mind the terminology I'm using. Schizophrenia suffering person. I'm trying not to call him schizophrenic, because when I call somebody mad, crazy, wacko, then I am in a way insulting that person, a person who is actually mentally ill, a person who needs our empathy, not fun or making fun of him. So I am calling this person as all types of schizophrenia require psychiatric helps, and along with that the counseling and psychotherapy also works. So we'll talk about this, but this is slightly out, so it's a huge topic, it's a vast topic. Yeah, sir, you were saying something.
What do you mean eating disorder?
Eating disorder, that is bulimia. Bulimia, B-U-L-E-M-I-A, bulimia is something like wherein people eat when like they're depressed, they eat too much, they are emotionally affected, or eating patterns go haywire. Like for example, in place of eating in the day, they start eating at night. Yeah, so various in any way which is going against your regular pattern of life can be a disorder. That's what we discussed. Yeah, anorexia also, wherein people don't eat at all. So the person is like too thin, and then they sometimes take help to regulate their eating habits. Yeah. So these are the disorders which we call common mental disorders, which can be dealt by a normal psychologist, counselor, psychotherapist without the help of psychiatrist. But in the severe mental disorders, we always need to have a hand in hand with a psychiatrist, because there are medicines, there are very, very proper, you would say specified, prescribed medicines by big organizations and government sanctified, and they even get some kind of discounts also these days on mental illnesses. So we always say that for severe mental disorders, please always take in-hand advice of a psychiatrist. Now coming to the part wherein I was going to talk to you about myths. I would like to know your side of the story first. What are some myths which you feel are there in mental illnesses?
The people who are mad people, they go to the psychiatrist.
Okay, the myth is that only mad people go to psychiatrists, and how do they define mad?
One who is not normal.
One who is not normal is mad. Okay.
Sound-minded.
Not sound-minded is mad. Sir. The one who is not sound mind. Okay. Bharat?
Myth is that some god or goddess has entered that person.
Oh wow, I like this. Please. Bharat says ki there is a myth that some god and goddess has entered the body of the person and he has become mad. Which is right. That's how, yes, black magic has come, and and the Babas come and they do it. Yeah?
Are you believe?
Certainly I wouldn't, sir, because I'm doing a session on myths and facts. So naturally I'll not believe it. But yes, I would say that when I'm saying about mental illnesses, the old beliefs and rituals have a very strong effect on our mind and brain. And sometimes because human body human behavior is a lot of copy and paste. From the beginning, a child learns a lot which is in the surrounding, in the society. So we cannot ignore them also. Spirituality, religious beliefs, today in today's scientific atmosphere, we are trying to work along with these. We are taking the alternate healers, the people who are into religious healing along with us and working. We do not believe in isolating them because they have certain hold on the crowd. The people have belief on that. What we believe in psychology is then when you start believing anything positive related to anything, may it be spirituality, may it be religion, may it be some idol, it works on you. What works is the thought actually, but that thought gets attached to some sort of belief. So we don't say that it is completely no, but yes, in USA there are various spiritual healers who actually work on soul and mind. And they are licensed spiritual healers, licensed. They have a document on saying that they have cured and healed these people. However, in India, we are still much behind. We do not have such documentations and research. So maybe in your area, you might be knowing somebody who does this kind of healing. You know, trying to cure a person out of this kind of, as what Bharat says, ki some soul has entered you and you are behaving like someone else. But we in India do not have a licensed body. We don't have anything which can give a certification here, there to say that this person is qualified for doing that kind of healing. That's why you have to believe in something called references. So I'm not saying a complete no to it, that there is nothing like it, but there is a belief system which is related to it. And
society and government also not accepting this type of science.
Government certainly would like to see more scientific data and scientific, yes. But as I said, India is very backward in this field, number one. In India, we are still not into research. We are still not into documentation. That's why we do not have proof of various things which are happening. We term things as paramedical science when we are not able to find a proper proof against something. So I would say that again what Bharat shared over here, that the soul entering into your body and all, I am not saying that I completely agree with it also, but I think it's still a matter of research. You know, like your second birth, that is also a matter of research. Taking second birth, coming into a family again, or remembering things from your first birth. Like Hindus believe in first, second, third birth, but Muslims don't. And India is a whole aura of different castes and societies. So we still need more proof and more documentations on it. Yeah? Now coming to my first myth over here, I am talking about, there is a myth which says psychiatric disorders are not true medical illnesses like heart disease and diabetics. This is a myth, like, you know, that people who are suffering from any kind of madness or any kind of wacko craziness, they are probably not scientific diseases. Well, the research says that the fact is all sorts of mental illnesses have a research based truth that they are either genetically or in some way biologically or physically attached to your body. In the sense, if somebody in a family has committed suicide and you go into the research data, there might be somebody in the family who had clinical depression 1 or 2 generations ahead also. There can be cases like, for example, somebody in the maternal side or paternal side may have had some sort of a history of having clinical depression and suicidal thoughts. So suicidal thoughts have been passed on genetically to that person who is now getting some sorts of suicidal thoughts. So, but yes, as I said, since we are bad on research and documentation, we often are not doing it on paper and proving it out. But the research says that all types of brain disorders, chemical brain disorders, are just like heart disease and diabetes and legitimate medical illnesses. Legitimate medical illnesses. Nowadays we also have a lie detector. How does a lie detector find that you are lying? We have a lie detector? Mr. Parthasarathy, can you explain them? How does it say that this person is lying?
No, lie detector is basically an instrument just like it reads blood pressure, an instrument attached to the temples. So when questions are put, if his palpitation rate will vary when he gives an answer. If the palpitation rates are not falling within the parameter, that means he is not telling the truth.
Or there can be, you know, raises, rise or low going in his blood pressure, or even his body language. If you know he's feeling shivery or he's showing signs of anxiety, can be various areas where he is completely observed and again observed on a lie detector, and then made sure of ki, okay, when last time when we talked to this person and now we are talking to this person, this is the difference. This is the disparity in behavior and in the brain, you know, yeah.
One more point is when we place a lie detector, that brain is neutralized.
Right.
Because he is taken away from the normal capacity to talk.
Right.
He is put into neutral state.
So even the brain waves are put on a neutral state when we are talking about a lie detector, so that we are able to see the difference in his entire chemistry, and then we are able to judge whether this person is really lying or not. So we have various testings and various assessments nowadays which are giving you very good data on behavior, on personality, on various things which you are doing in behavior. Like for example, if I would have, like, you know, earlier thought of probably administering a test, something called general health questionnaire, you know, I could have given it to you, and there are areas in your life which this test is going to assess. Like, are you like prone to depression? Are you having any kind of anxiety? How are you with people, your societal, you know, understanding and communication with people? So there are various assessments which have a very verified and with proof understanding that they are true about you, and there's a lot of years of research which has gone into it. So we no longer consider mental illnesses as just a thought or behavior. It is a proper disease. We consider it as a disparity in your complete biological being. The second myth I would like to talk to you about here is people with severe mental illness such as schizophrenia are usually dangerous and violent. How many of you believe in that? That's a very common belief. Schizophrenia, which is supposed to be a very strong severe mental disorder, do you think that people are very violent?
Yeah. Sometimes.
Have you personally seen a schizophrenic in your life, Bharat? Yes, you have?
Not come across.
You have never come across, sir? Have you come across? You have?
Hiding the own identity, is telling the other.
You have seen somebody who is into the...
Pulling the other people.
Okay, you have, sir?
They're not violent all the time, you know.
Yeah.
Some of them are not violent at all, in fact.
In fact, you're not able to get that this is a schizophrenic because we think they are violent and they are not violent.
No. This is not violent, but they are telling I am some different person.
Okay. They may be having a different personality issue or their identity issue, okay? But have you ever seen a schizophrenic in your life, sir?
Yes.
You have, okay. You have not. You know, when I was just talking to